The key challenges that I think academic philosophers face in trying to make access to health a reality is one, that there are a number of significant conceptual questions. So one of the first ones is that we know now that access to health is not just about access to health care. It's also about access to a variety of social conditions externally. And so when we make arguments about people have rights to health care, we're not getting a full picture. We want to say people have a right to the conditions that allow them to be healthy, or society has an obligation to address factors aside from healthcare. Healthcare is important, but a lot of other things are also important in health. So this is one of the, I think, key ideas that needs to be expressed more clearly and told. The second challenge is the idea that the great inequalities in health between people living in poor countries and rich countries is actually a moral problem. Some people think that it's not an ethical problem. They think it's because it's a financial problem or a material problem or a governance problem, and so they don't have to worry about it being an ethical problem. And so for people like me, what we're trying to say is that this is actually a moral and ethical problem that we have to deal with, and so that comes first and the money and the resources come later as a result of the way that we talk about it. The solutions to the problems that an academic philosopher faces as opposed to someone providing healthcare in the ground, I think, are very different. We have in no way the same kind of issues that someone who doesn't have resources or someone who's facing a lot of material difficulties or cultural difficulties in trying to promote healthcare. Academic philosophers tend to work with ideas, and so the solutions, I think one is to get out into the world more and understand the practical reality. So rather than just sitting in a room and writing philosophical ideas that are correct or beautiful but have no relevance to the world, I think is one of the things that has been so far the way that academic philosophy work. Now what we're trying to do, and I'm thinking this is one of the solutions, is that we meet with people who are providing healthcare, who are doing research. We also learn these different disciplines so that we have a much more relevant idea of what's happening in the world, and we can actually help people in doing that. The Geneva Health Forum is really unique and something that I was very excited to get an invitation to speak because Geneva has a reputation for being a place of meeting ground that people from around the world come, not only government representatives but people working in all different ways. Unlike in some other meetings where you feel as though it's only talking about rich countries, or it's only talking about poor countries, or it's only talking about corporations or medical companies, here what we have is, I think, a very purposeful place that's been created that tries to bring together lots of different kinds of people: frontline workers, academic researchers, policymakers, philosophers like me, and it's an environment that is trying to get people to talk on an equal footing. And I think that's one of the most important things about improving global health, is that we need to have these kinds of conversations rather than one-sided implementing programs or something like that. And this is one, I think, that's very important, and that's why I think the Geneva Health Forum is quite important. The second thing about the Geneva Health Forum and this particular event this year is this idea that frontline health workers, people who are providing and dealing with health issues on the ground in a variety of settings, rich and poor countries, have come together. Not academic researchers, not sort of policymakers, but people who are providing it, and they're sitting side by side and talking about their experience. It sounds very simple, but it's actually a very important thing to do, is to get people on the same table and to be able to get people to talk about things. I think that's a really important thing that has lots of good consequences.